Welcome to Adapting Class. Mental health concept is something that you should be familiar with. You should be feel more comfortable. There's some questions that can evade you. You can make a mistake a little bit because of the way you read the question. These are few I've selected from my Q bank and then trying to make a questions out of it. So I'll call it most likely to mix. Which statement require most urgent follow-up? A client with major depressive disorder has been taking Sertraline for 2 weeks. How do you answer questions? Read it from the back. Which statement require for most urgent follow-up? The keyword, the buzzword is follow-up. And what is that follow-up? Urgent. What is the problem? Client, as that's the buzzword. Major depression is taking what? Sertraline, another buzzword. So we have what? Depressive disorder, one, and then Sertraline, two, and then follow up. Those are the one you focus on. These are the things you focus on to answer the question urgent, right? I say, I feel tired than usual. My appetite is finally improving because I'm taking Sertraline. I have more energy to get things done and I feel hopeless, but I don't care anymore. I still feel hopeless. We all know when you take SSRI, when your energy improve, when your energy improve, you're more likely to commit suicide. So option three is dangerous, right? Have more energy to get things done, but the way it's framed, it may mean positive or negative. So it's not completely negative. I have more energy to get things done. If you have suicide ideation, this become a priority. But if you look at the last one, he said, I still feel hopeless, but I don't care anymore. Hopelessness and apathy is a bad combination. Is a bad combination. Is a bad combination. So you have hopelessness plus apathy is bad. So it's worse than feeling that your energy is improved. This can be positive and negative. We all know most of the time this is a priority. But I give you another option that you should watch for on your NCLEX. That's where I said, most people are likely to mix this and say, I still feel hopeless, but I don't care anymore. You have hopelessness and you have apathy, bad combination. So this is more dangerous than the rest. So that's why I say these statements indicate self-harm. And then if you have hopelessness and apathy, high risk for suicide. It's worse. I know your energy is improved and you're going to commit suicide, but the word hopelessness and apathy negate that information. So D is right answer. What is the next best action? A client receiving lithium therapy for bipolar disorder report vomiting, diarrhea, and hand tremor. Whenever you have GI symptoms, it's lithium toxicity. So this patient is indicating early stages of lithium toxicity. What do? Tell the client to drink more fluid and take the next dose as prescribed. It's too late. It's having symptoms. We need to stop the lithium. Or the lithium, check the client's lithium level. Give the client an antiemetic to control nausea. The GI symptoms, it means bad problem, lithium toxicity. Encourage the client to eat a high sodium snack. It's too late. I'm having symptoms related to lithium toxicity. Hold it and then check it level. What is the a nurse is caring for a client in alcohol withdrawal. So it's in the beginning of alcohol withdrawal. Which intervention should the nurse include in the plan of care? Select or apply. Go back to your content. What is alcohol withdrawal? What are the symptoms? There is different kind of symptoms you will see from each stages until you develop delirium tremor. In the beginning, you have tremor, you have restlessness, you may have anxiety, then it progresses. So what are you going to do? Administer lorazepam as prescribed, monitor for seizure agitation, provide low stimuli environment, and then encourage caffeine intake is a bad thing, right? Encourage caffeine intake is not good. Start a low protein diet to protect liver function. No, they don't need to. They just alcohol withdrawal unless they have end stage alcohol disease. Yeah. So those are the things you do. What is the next priority action? And this is caring for a client with major depressive disorder who state, I just want to end it all. That means he want to kill himself. The first thing is safety. What is safety? Find whether they have a plan. Ask the client if they have a specific plan. Good choice. Encourage the client to express their feeling. It's good to let them talk about it, but you need to know why they said they want to anymore. Or notify the healthcare provider is good, but you want to know if they have a plan. Reassure the client that things will get better. Bad choice. This is better. Which food should the client avoid? These are questions, these are concepts you have to get comfortable with for the NCLEX because they are really likely to miss and more likely to show up on your NCLEX. And then it's providing district teaching to a client taking Phenelzine for depression. What food items should you avoid? Is what? MOI. You should avoid food that is aged. I see aged cheese. You should have food that is what? Cured meat salami. You should have food that is fermented. Tofu. Fresh vegetable and grilled chicken is not. Which finding require immediate intervention? Bad problem. A client with schizophrenia is prescribed haloperidol. It's a first generation antipsychotic. What you are going to expect is mostly NMS or EPS. A dry mouth, blurred vision, anticholinergic side effect. It's not big. Shuffling gait and high tremor is extrapyramidal side effect. Fever and muscle rigidity is NMS. Weight gain and drowsiness is expected, one of the expected finding. Therefore, NMS is worse than EPS. Which intervention is most appropriate? And this is caring for a client with bipolar disorder experiencing with mania. Put them in a quiet environment, put them in a no group therapy, provide high calorie diet, and take care of them. Encourage group therapy, wrong choice. Offer high calorie diet, good. Allow the client to set their own schedule. They will screw it up. Provide detailed explanation. They cannot concentrate right now. They can't set their schedule. They can't take care of themselves. High calorie. Which symptoms require the most immediate intervention and necessary for a client with alcohol withdrawal? I explain it to you. You start early and you go in DT. Anything that shows neurological and cardiovascular compromise is number one. Anxiety, insomnia is the beginning. Diaphoresis and irritability is the beginning. And tremor and nausea is beginning. Blood pressure, this confusion, bad. Which nurse intervention are appropriate? Select or apply. A client with bipolar disorder is experiencing what? Maniac episode. Maniac episode, right? What do you want to do at this time? Provide eye carry finger food, expected. Good. Offer structured activity with minimal choices, right? You don't want them to make, if they have to make choices, they will choose whatever they want to. Encourage the client to attend group therapy. It's not a good choice. Reduce stimuli. That's good. Allow the client to take frequent nap throughout the day. It's not good. They shouldn't take frequent nap throughout the day. It's not a good idea. It's easy to pick number five. That's why I say these are most likely to be mixed because they cannot fall asleep. Okay, if you let them take nap throughout the day, when it gets in the evening, they will not sleep. So you got to provide a structured bedtime routine rather than frequent naps, right? A client with borderline personality disorder tells the nurse, "You are the only one who understands me. Who understands me?" The night nurse is so mean. It doesn't care about me. Splitting. Signs and symptoms of borderline personality disorder. You got to be strict. Set rules. Don't let them manipulate you. Which answer choice indicate that? I'm sure the night nurse is trying her best. It does not help the situation. You are reinforcing a judgment. I feel like you are trying to manipulate him. You know that, but you don't say that. Don't say that. Let's focus on how you are feeling instead of talking about the night nurse. That is good. Finding more about her. I will talk to the night nurse to make sure they treat you fairly. You are accepting whatever they told you is true. Let's focus about you. Which finding requires the nurse immediate action? A nurse with a client with schizophrenia is prescribed clozapine. Clozapine is second generation antipsychotic. One of the biggest side effects is agranulocytosis. Sedation and drooling is associated common side effect because it causes hypersecretion. Therefore, this is expected. Weight gain, constipation is expected, right? These are all anticholinergic side effects. Sore throat and fever is agranulocytosis. And dizziness when standing is orthostatic hypotension is expected. Therefore, that C is worrisome. Which action by the nurse is the most appropriate? A client with an eating disorder is admitted for severe malnutrition. What do you want to do? Get them to gain weight, take care of them, provide their physical need before the psychological need. Allow the client to choose when they want to eat. No, you need a structured diet and you have to monitor it. Set a structured meal plan and monitor them during a meal. This is better. Encourage the client to eat alone to avoid stress. No, physical need is most important. Weigh the client daily and let them see the scale. It's fine, but structured meal is better. What is the next best action? A client with PTSD suddenly become tearful and state, I feel like I'm really reliving the worst night of my life. That's severe anxiety. Provide safety for this patient. Encourage the client to talk about traumatic event in details. It's okay, but she doesn't want to really leave the thing. So why do you want to talk about it? Because you want to avoid it. Even though it's a good idea. Remind the client that they are safe and orient them to the present. Like safety, make sure they know that they are secured. Tell the client to take deep breath and ignore the thoughts. They cannot do that. It's an intrusive thought. Ask the client why they are thinking about the event right now. It's not their fault. That's why it's called post-traumatic stress disorder. Therefore, remind with them. And this is caring for a client with antisocial personality disorder who frequently break unit rules. Make sure you set the rules. Tell them to stop breaking the rule. But you got to be therapeutic. Set clear limits, consistent, enforce consequences. Offer special privilege. Bad idea. When the client follow rules, you bribing them. Frequently remind the client of how their behavior affect others. It's good, but it does not fix the problem. Use sympathy to encourage behavior change. You're bribing them. Set the rules of their house. Which statement by the client shows the best understanding? And this is teaching a client with panic disorder how to manage panic attack. How to manage panic attack is to decrease your anxiety, which answer choice indicates decrease anxiety. You see the way I answer the question? I don't use too much information, just the basic concept. Decrease anxiety is the best way to deal with your panic attack. I will try to focus on breathing and use relaxation technique. Yes, this is decreasing anxiety. I should remind myself that my symptoms mean I'm dying. That's worsening your anxiety. I will avoid places where I have had a panic attack before. You are avoiding, you're not coping well. I will take my medication only when I feel an attack coming. It's not going to work. It's an anxiolytic. It takes some time to work. Therefore, which one is good? Realization technique. What should the nurse do first? A client in a psychiatric unit suddenly become agitated, shouting, and pacing aggressively. Safety, safety, safety. But before you provide safety, can you de-escalate the problem? You can provide safety, but you have not provide de-escalate the problem. Always de-escalate before you provide safety. Call security and prepare to restrain them. Restrain will worsen the situation. Tell the client to stop the behavior immediately. He's not going to listen to you. Move other client out of the area. Safety, that's good. But is there any de-escalation? Put them in the quiet environment. This may help with the situation. Which finding are expected? Select and apply. I have a client who has obsessive compulsive behavior. What do I expect? That's all. What do I expect in obsessive compulsive behavior? Is in their name. Obsession, something that indicate obsession here. Compulsion, something that indicate compulsion. The client engages in repetitive hand washing. Obsession. A client experiencing intrusive, unwanted thought is coming, right, in their brain. The client believes their compulsion will prevent the disaster. It does not. The client expresses distress about their compulsion, but they do it anyway to remove the anxiety. The client enjoys performing compulsive behavior. They don't. They hate it. Which finding indicate the medication is effective? Select and apply. The client is assessing it. NS is assessing a client with the schizophrenia who is taking risperidone. It's antipsychotic. That's second generation. What do you think? I have schizophrenia, then my symptoms should improve. The client report hearing fewer voices, hallucination, getting better. The client initiate and maintain conversation, is talking well. The client has frequent hand tremor and muscle rigidity, NMS. This is side effect. Or this may be dystonia, akathisia, whatever, but mostly sound like akathisia related. A client does side effect. The client maintain appropriate personal hygiene, is taking care of himself. The client sleeps 16 to 18 hours. These sound like catatonic features. That's not good. So these are questions likely to be mixed. And Adam Deckless, thank you for watching. Take care of yourself and all the best of luck. If you need more, check out that class and good luck studying. Bye.